How is H. pylori diagnosed without endoscopy? Have you ever wondered how doctors can diagnose Helicobacter pylori infection without using an endoscope? This is a common concern, especially for those experiencing symptoms related to ulcers or peptic ulcer disease. Fortunately, there are several non-invasive tests available that can help identify this bacteria effectively. One of the most popular methods is the urea breath test. In this test, a patient drinks a solution containing urea that is labeled with a carbon isotope. If H. pylori is present in the stomach, it produces an enzyme called urease that breaks down the urea. This process releases carbon dioxide, which can be detected in the patient's breath. The urea breath test is known for its high sensitivity and specificity, making it a reliable option for diagnosing active infections. The entire process usually takes about 15 to 20 minutes, and it can also be used to confirm whether the infection has been successfully treated. Another effective method is the stool antigen test. This test looks for H. pylori antigens in the stool. It boasts a sensitivity and specificity greater than 90% for detecting active infections. The stool antigen test is generally less expensive than the urea breath test and is also useful for monitoring treatment outcomes. Serological tests, or blood tests, are another option. They detect antibodies against H. pylori, indicating whether a person has been exposed to the bacteria. However, these tests have limitations. They cannot reliably differentiate between current and past infections because antibodies can remain in the bloodstream long after the infection has been cleared. Therefore, serological tests are not the best choice for confirming active infections, especially in areas where H. pylori is less common. These non-invasive tests are particularly beneficial for patients who do not exhibit alarm symptoms, such as significant weight loss, bleeding, or anemia. In such cases, doctors may adopt a test-and-treat approach for managing dyspepsia and peptic ulcer disease without immediately resorting to endoscopy. However, it is important to note that while these tests are effective for diagnosing H. pylori, they cannot detect complications like ulcers or gastric cancer, which would still requiring endoscopic evaluation. In summary, the urea breath test and stool antigen test are the most accurate non-invasive methods for diagnosing H. pylori infection. Serological tests have limited usefulness in this context. If you suspect you have an H. pylori infection or are experiencing symptoms related to ulcers, it is essential to consult a healthcare professional for personalized advice and appropriate testing.